The wife of one of my patients described to me their rehab journey as DIY rehab. What she meant by that was that they had to direct their own rehab because they felt that they didn't have a clear long-term rehab plan. I love the term DIY rehab because I feel that it captures well the changes in the health system since COVID. The resources are now more limited than before, and therefore patients had to advocate for themselves even more than they had to previously. As a rehab clinician, when I look at the brain scans, I can see the specific areas that are affected, which gives me a clear indication of what is more and less likely to recover. With the brain imaging information, we can work out a long-term rehab plan, and I can give my patients good guidance for optimizing their DIY rehab. Head to my website to learn more about stroke, brain imaging, and other conditions.